Thank you very much for that introduction. I'd like to say good morning, good afternoon, and good evening to all of the participants. And let me start by thanking UN Environment Program and Asian Institute of Technology for kindly inviting me to speak in this webinar. We had a similar webinar too, actually, on this topic earlier this year. And I was invited to speak on the topic at that time as well. At that time, we had very little published data on the generation of healthcare waste during the COVID-19 pandemic. But one of the best documented case studies was the experience in Wuhan, whose data are summarized here in this slide. The healthcare waste, the waste stream multiplied sixfold in the early stages of the pandemic in Wuhan. Now, keep in mind that typically up to 70% of healthcare waste is plastic, even under pre-pandemic conditions. So we saw at a very early stage in Wuhan that tremendous amounts of plastic healthcare waste are generated as a result of the pandemic. I was able, when we addressed this in an earlier webinar earlier this year, I was able to gather some anecdotal information on healthcare waste during that early stage of the pandemic from gray literature and from personal communications. And the little data that we had at that time all pointed to tremendous increases in the quantities of healthcare waste being generated in the pandemic. Professor Viswanathan, in his technical report and his webinar presentation here today, has really pulled together an amazing collection of data, which amply illustrates the huge increase in plastic healthcare waste, which the pandemic has triggered. And I really sincerely congratulate Professor Visu for his work on this topic. Now, I think that there are two common misperceptions that are contributing to this situation. We may call them myths or misinformation. One is that all waste from COVID-19 facilities is infectious. Wherever this myth prevails, all waste from the facility is carted off together to an incinerator or landfill or to an uncontrolled dump site from which leakage may occur. Another misconception is that single-use PPE is always safer than reusable PPE. The consequence of this myth is that large quantities of PPE is the disposable type, and little or no use is made of reusable PPE. Both of these myths are contributing to the massive increase in quantities of healthcare waste that we see during the pandemic. I will address these two myths in the next two slides. In reality, according to WHO, the World Health Organization, healthcare waste from COVID-19 facilities is no different than waste from any other healthcare facility. Up to 85% of healthcare waste is non-infectious, and up to 70% is plastic. At the early stage of the pandemic, it was widely feared that the virus that causes COVID-19 could be transmitted by touching surfaces. In the course of time, however, we have seen that there is no evidence anywhere that COVID-19 illness has been caused by handling healthcare waste, including plastic healthcare waste. As long as WHO's standard procedures for safe healthcare waste management are applied, which includes, very importantly, segregation of wastes at source, then there is no need for any facility to lump all of its waste together and consider it all to be infectious. With regard to PPE, medical masks are recommended in most hospital settings, but non-medical masks made of fabric offer adequate protection in most community settings. The use of non-medical masks in community settings could go a long way towards reducing the demand for disposable masks. Second to masks, plastic gloves are one of the leading categories of disposable PPE. The use of plastic gloves in community settings stems from the fear of touching surfaces, which we have seen actually poses little risk of COVID-19. Health authorities generally do not recommend the use of gloves in community settings, except when used for patient care in the home. Now, WHO has mounted a massive global communications campaign to identify, categorize, and push back against a wide range of misinformation related to COVID-19. Plastic waste is not among the topics that WHO is tracking, at least not yet, so you may wonder, why do I mention it? Well, what I want to emphasize here is that the campaign is driven not by doctors nor by epidemiologists, although they certainly have a role in it. The campaign is driven by communications professionals. And if we want to combat misinformation on plastic wastes, it is not engineers or environmentalists whom we need to be looking to for help. It is communications professionals. This slide shows some strategies for addressing misinformation that has been put out by the US Centers for Disease Control. Now, US CDC is talking here in relation to misinformation on vaccinations, but I think these strategies are applicable to combat any sort of misinformation, and they may be helpful for us. One strategy is to listen to and analyze the misinformation that is circulating in the community in order to understand where, what, when, who, how, and why that information is spreading. Secondly, to engage with and listen to the community to identify and analyze perceptions, content gaps, misinformation. Thirdly, share accurate, clear, and easy to find information that addresses common questions. This can be done through websites, social media, and the like, but it's also important to use methods to reach those who have limited or no internet access, such as radio or community events. And finally, use trusted messengers to boost credibility and the likelihood of being seen and believed over misinformation. Use channels and sources that people look to and trust for information, such as religious leaders or community organizers. My final remarks here now are simply to endorse Professor Viswanathan's recommendations as they apply to the healthcare sector. Certainly, I agree that there is a need to encourage responsible consumption behavior, both at the level of institutions, where healthcare facilities procure PPE in large quantities, and also at the community level. As I've mentioned, an effective communications program is needed in order to accomplish this. In terms of innovative solutions, I would say that we have become such a throwaway society that going back to basics like washing aprons and gowns could nowadays be seen as an innovation. And thirdly, I certainly agree with the recommendation to accelerate policy towards implementing the 3 R's in healthcare waste. WHO and the NGO Healthcare Without Harm have been working on that for many years, and I would strongly encourage UN Environment Program to partner with them in that effort. In closing, I would just like to congratulate Professor Viswanathan once again for his excellent report. And once again, I would like to thank the UN Environment Program for the invitation to speak with you all in this webinar. That's all that I want to share with you, and I will be happy to answer any questions. Thank you.